Hello, and welcome to today's Lunch and Learn presentation, Make the Most of Your Virtual Visit. I'm Steve Reinches, President and CEO of North Kansas City Hospital, and thank you for joining us today. I'd like to go over a few housekeeping details before we start. We have muted all attendees to help reduce on feedback. If you have any questions, please submit them through the Q&A feature at the bottom of your screen by clicking on the icon. Our speaker will answer questions at the end of the presentation. During the past year, you may have heard the words telehealth, telemedicine, virtual visits, or virtual care more than you have before, and wondered what exactly those terms meant. They all refer to online care, much like we're meeting virtually today. Virtual visits allow you to connect with your healthcare provider via the computer, smartphone, or tablet from the comfort of your own home. Dr. Samin Akhtar, an internal medicine physician with Meritas Health, North Kansas City, is one of the many North Kansas City and Meritas healthcare providers who offer virtual visits. She's here with us today to talk about what to expect from a virtual visit, which medical conditions are treated virtually, and how to make the most of your time online. Please welcome Dr. Akhtar.
Hello, good afternoon. I am Samin Akhtar, as Dr. Ranjis has just very nicely introduced me to you guys. You guys might be you might be my patients already. So I am here just to take some worries off of your mind when you think about a virtual visit. So I'm here to help you make the most out of your virtual visit. What is a virtual visit? Basically, it is a very simple and secure way for you to see your doctor, or if you are seeing a nurse practitioner, by an appointment, and it is all run through online. You can stay in the comfort of your own home. You don't have to drive. You can avoid the risk for getting exposed to COVID-19 or flu or any other contagious diseases. You can maintain the continuity of your care, including all different medical problems that you have had, or especially good for our pregnant ladies who are going through high-risk pregnancies and they don't want to get exposed to the current pandemic. Also, good thing is this, that if you are working, you don't have to take a whole day off or a half day off from your work to come see me. You can just take time off from your work the minute you know that your physician is ready for you. You can spare some time, get the quality care, and you can go back to your work without wasting any extra time. Also, if you're a mommy, you don't have to worry about who's going to watch my kids. Can I take my baby with me to the doctor's office? You can just skip finding a babysitter. You can just do it in the comfort of your own home. Also, I see lots of my patients. I am currently having a patient in my practice that I've never met in the office. We established her because she was a fall risk. So if you are a fall risk or you have multiple other disabilities or inabilities, I can see you from your own home and discuss with you, and we can address all your medical problems. So let's start. What do you need to be on the virtual visit? As all of you guys know, that you have to set up an appointment. So we would kindly request for you that you schedule in advance. You set up a meeting like the way you call our offices to set up an appointment. You can inform the front desk or whoever is scheduling your appointment that you want to get a virtual visit. Now let's talk about the things that you would be needing to at your home to start that visit. Of course, you need a camera because you want to see how does your physician look like and you have to show them some things. You also need a microphone and a speaker. I have gone through the research and we have found out that multiple physicians have found out those patients who were using their laptop or their desktop computer, they were able to talk to their physicians much easier compared to those patients who were using their smartphones or your tablets. But actually, I have conducted visits both on the smartphones as well as tablets, and we can communicate very much easily without any problems. In addition to these devices, you need to have a web browser. So actually you can use all, and I have named almost all of them: Chrome, Firefox, Microsoft Edge, or Safari. You would also need, of course, an internet connection so that you can lively communicate with us. Another important thing is this, that you need to set up an email account or you can have a text messaging service. In my practice, I've seen that text messaging works much better compared to the email, and patients just click on that link and they can get started. Another important thing, because you are not in my office where I can shut the door and give you the privacy, you have to create a private setting in your own home. So if you're working and you're taking my call, our call from your office, I would want you to kindly go into a secure room so that you can confidently and privately talk to me and tell me about all the problems that you're having. So let's start how the virtual health visit starts. First of all, you're going to get a text message or you're going to get an email from us, which is going to give you a link that your doctor is online and waiting for you in the waiting room. Kindly click on that secure link, and then you have to allow your web browser a permission so that you can use the camera or the microphone, especially if you are using the virtual visit for the first time. Once you become used to it, it will be a knee-jerk thing for you. Now, kindly enter your name so that the doctor's office knows that you have arrived in my meeting session. While you're waiting for us to be in the line, as you know, us physicians, we are always behind catching up on the previous patient or something. I think that is a good time for you guys. You guys click on the pre-call test button to test your camera. You can check your microphone, you can check your speaker, pretend as if you are trying to communicate and tell me what's going on. That will alleviate a lot of your worries. So some of the offices are currently giving us this service already, but sometimes you'll have to skip this step. For those offices that have the patient service representative available, you have to register. It is again a link. If you have not visited in the Meritas health providers before in the last 1 year, or your insurance has changed over the last year, we would need you to kindly upload a picture of your driver's license. So what you can do is this: you can take a picture with your camera phone and just the link will tell you to upload where it is, and it will be easy. And if you have any questions, kindly feel free to ask us how to do that. You can also upload the front and the back of your insurance card. Like all other offices, when you come to our office, you sign a HIPAA form, information, same thing here. You can review the data that has been entered or you can correct it. And then you sign electronically and you can give us a consent that you are okay with your physician to start discussing your medical problems. Another good thing about this is this: it will also provide you with a link that you can co-pay if one is due at that time. You can request your receipt if you desire. Now, this is an important step, and this is actually where we are doing in our office at this time, that you will meet with my nurse before you meet with me. So my nurse will call you. She will ask you if you have an availability to check your blood pressure, your pulse, your temperature, if possible. Don't be afraid. If you don't have your blood pressure machine, you can't check any of these, it's okay. We can still conduct a whole visit as we do. For my patients who are familiar with pulse oximeter, if they can check their pulse ox, like our patients who have lung conditions or heart conditions, it is very important for us to know their pulse ox. Again, if you don't have a pulse oximeter, do not get worried at all. We will still take care of you. Another thing, my nurse, when she calls you, she would want you to kindly tell her all about the medications that you are taking. I always tell my patients to put all of their medications in a Walmart or a shopping bag and put it in front of them so that they don't have to go back to their drawers to check what medications or herbal supplements or multivitamins and what doses are they taking. So the nurse will go over all the medications and they're going to enter it into your chart the way we do it in the office. So it's exactly the same. As physicians, especially I'm an internist, so for us, medications are very vital, important part of your medical care. So after, and rest assured, don't put them away. I will come back and I'll start asking you more questions about those medications. So this is the main background that our staff is going to set up for us. And then you can proceed to see your nurse practitioner or your physician whom you want to see that day. Towards the end of your visit, there is a provision that it will allow you to disconnect and that will complete your visit. I want to tell you one important thing here. Whatever my nurse does with you or my front office does with you, that does not apply to the time that we spent with you. The actual time that we bill you for or we give it to your insurance company is the time when I start talking to you and you get face to face with me. Now, it's a very important question, and lots of my patients ask me what kind of visits that I can perform online. We can do almost everything. Let's start. All your chronic medical problems, your heart, your lung, your kidneys, we can discuss with you. You can feel free to ask me all the questions about those. We can evaluate you if you think that you have been exposed with someone with COVID-19, or you think that you had it before and now you're wanting to go back to your work, you need the clearance from your physician, or you need any kind of help regarding COVID-19, we can do all that, and we have been doing it successfully throughout this pandemic. Again, the other things that we can follow you up for is your, of course, blood pressure. If you have hypertension, we can safely do everything for you. If you have endocrine problems, especially diabetes, thyroid issues, we can address all of them for you. Now, if you have been hospitalized and you are wondering what is going to happen, we can easily do your post-hospital discharge follow-up. We can do, especially the transition of care management that Medicare takes pride in, we can do all that. I can also do your physical via this visit. We can do the regular healthcare maintenance. Lots of my patients have papers from their offices that they need to turn in. We can do all that via telehealth visit or virtual health visit. We can do all different kinds of Medicare wellness checkups. I can do your initial primary Medicare wellness first visit. We can also do your subsequent Medicare wellness visit over via telehealth as well. If you are wondering about your mental health, I think we can very fairly help you with all different kinds of mental health issues, anxiety, depression. Of course, our psychiatric friends, they can take care of the bipolar disorder. If you are a new patient, you should not be hesitant to log on to the virtual visit, because we can start establishing you into our practice very brand new from the scratch, everything via this type of visit. Again, then coming on to our friends who have to go through elective surgery or some other form of surgery, we can do the pre-op physical. We can do the preoperative clearance for you. We can also do your perioperative care, like if somebody's blood pressure goes up or they found an abnormal lab, we can do that for you. And of course, post-operative visits can be managed as well. Another important thing here that I can highlight, we can take care of your urgent care needs while you are on virtual visit. We can take care of most of them. So again, during your visit, you will be wondering that you are not in my office. What can the doctor do for you? I can make you relax about this thing. A physician who has been in practice for some time, who has a good training, just by looking at you via your camera in the comfort of your home, we can get a clue into your general overall well-being. We can assess what is going on with you. And my more experienced physician friends, just by looking at the color of your skin, they will say, oh, this patient is in congestive heart failure, or they are having their exacerbation of the COPD or something like that. Next, we can also review. I know you have discussed with my nurse about all of your medications, but I can again review them with you. We can discuss the dosages. You can tell me if you want to cut down. You can tell me about the side effects. If you want me to prescribe something new and adjust by assessment, we can prescribe and we can refill your medications as well. Now, coming on to the orders. Yes, virtually, we can perform all different, we can order all different kinds of blood work. You will have to go to the lab to get that. Currently, we don't have any provision that I can draw blood virtually, but we can order them for you. We can also order different kinds of tests for you, including the x-rays, the ultrasound, the CT, MRI, whatever is needed, we can do that. Now that I'm talking to you about your blood work and tests, while we are talking about the virtual visit, I would recommend for you guys to kindly set up your portal with Meritas Health. We have a very good portal system. The minute I see your labs, you can see them, you can ask me questions, and we can review the results at the earliest. What else can be done? Skin problems. I have had my patients ask me all the times, how can you look at my skin problems? In fact, camera with its magnification can show us some things that the bare eye cannot see. So most of the skin rashes can be diagnosed. I have diagnosed personally poison ivy, herpes, shingles, different kinds of early skin cancers, all other different kinds of skin diseases. And our dermatologist friends are very well equipped with that. You can also do your best to describe your skin issue to me as well if the camera is not working or it is not showing as much of a problem as you're having. Of course, I cannot check your pain. I cannot check the texture of your skin or the temperature. Now, since we have started talking about the things that I can do, at this time, I cannot listen to your lungs or your heart just from the virtual visit, but we should keep our fingers crossed. Hopefully there will be a day that I'll be sitting in my office and with a remote stethoscope, I can still check your heartbeat and the lungs. But right now, there is no provision like that. The other thing that I cannot do is examine you directly face to face, especially if you are having pain in your abdomen. There are certain markers that we use as physicians, internists, or nurse practitioners. We call the signs of acute abdomen, which shows an abdominal emergency. I cannot do that via the virtual visit. Same thing about your joints. I have started seeing that I can check the range of motion, but there are certain issues with joints that you have to put your hands on. So those are the restrictions. Another thing I have seen as an internist a lot, that patients get worried when they see that their blood pressure is running very high at home. I do not have any provision at this time that I can check your blood pressure when it is your blood pressure machine at home is inaccurate, and I cannot tell you if it's the correct blood pressure. So you will have to come in to our office for that. Now, there are some logistic problems that I cannot fix virtually, especially if your internet connection is not working well. Time and again, I have multiple patients who have started the conversation halfway through, it gets broken. Please do not get heartbroken. I will call you on your phone. I can talk to you on some other means, but if you have an internet connection, of course, I cannot fix on my end. Otherwise, and same thing, if you have trouble accessing your device or using your device, I will try to help you as much as I can, but sometimes it is a problem. We cannot fix your device. The other thing is this, that if you are working and you are taking the call from your office and you cannot find a private setting in your workplace, or some patients, if they are in nursing homes or they're living with other family members, if you cannot find a private setting, that will be one thing that we cannot take care of. The other thing, although I told you guys that I can perform your physical, but when it comes to those aspects that the physician has to personally perform a procedure, for example, for our ladies, for a pap test or for a rectal exam, these are the caveats that we can do virtually. Another important questions that a lot of my patients ask me, what are the which insurance companies are going to cover you for the visit? And I can tell you almost everyone covers now. When telehealth medicine started in the beginning, insurance companies were a little reserved in allowing their customers to go through that. Now you can see from the screen, most of these plans are being covered. If you can't see that, I can read them for you. Aetna, Blue Cross Blue Shield, Cigna, Humana, Medicare, as well as Medicaid, Multiplan, TRICARE, and United Healthcare, all of them allow you to participate in a virtual health visit. You're going to ask me, how am I going to bill? As with your regular office visit, all these insurance companies have allowed us to bill on the basis of the number of the issues that we are addressing that day. It can also be time-based. Just because of the being virtual, it is very easy for you to track the time that you spend face-to-face with your physician. I want to thank you guys for tolerating me with all these things. I hope I'll see most of you guys on the virtual visit. Thank you.
Thank you very much, Dr. Akhtar. That's very informative. It looks like we have a few questions. I'd like to go down to the first question, and that is, are virtual visits charged by the minute?
Yes, they can be charged by the minute. Usually, we do not want to charge you per minute, but when we see that we are passing the time, then we can charge you by minutes as well. And we have set codes guided by Medicare and Medicaid, and we can follow them.
So when I come to the doctor in the office and it's just a checkup, there's a certain charge in an insurance code. So is it similar to that on the telehealth visit?
Exactly. So actually, because we are doing the face-to-face time, Medicare has allowed us to charge you with the same billing codes as we were doing before.
So it is just like an office visit.
It's exactly like an office visit.
So here's another question. My husband and I winter in South Texas. Can I keep you as my doctor when I'm down in South Texas using telehealth?
That is an excellent question. Actually, I'll tell you that I have patients who go to Texas and they call me. I had a patient the other day telling me about the urinary tract infection that she was having. So I can call in the prescription. That actually, I think that is the best part of virtual visit. You can be anywhere and you can still be in touch with me.
That gives me peace of mind. Is there a time limit on a virtual visit?
Actually, honestly speaking, this is a new thing for the physicians as well. I have myself struggled with some patient. I had a patient who couldn't open her email. So we stayed with her for 1 hour and then we said, honey, it is beyond. So I'll call you later. So actually, we would definitely, as most of us physicians, we would love to be on time because we have other patients waiting. But actually, we will give you extra time if need be.
Is there any specific computer that you need to have a virtual visit? So could you use a desktop or a laptop or an iPad or a cell phone?
Yes, actually, that's an excellent question. Studies have proven that the laptop or a desktop computer work the best, but you can use anything that has camera and the phone. You can use it. All different kinds of smartphones, iPads, any other tablet, whatever you can get hold of, you can get in touch with us.
So when a virtual visit is scheduled or a telehealth visit is scheduled, how do I know if I see my doctor or my nurse practitioner?
We will inform you beforehand. That is your prerogative. You can ask that who is going to see me. Anyway, you're giving us a consent. If you do not want to be seen by somebody, that's your right. You can say, I want to be seen. Unfortunately, if your physician is busy or your nurse practitioner, your favorite doctor is busy, then we can give you options, but preferably we would love to make you visit with your own physician.
And when I have a telehealth visit or a virtual visit, will my doctor have access to my medical records?
Exactly. All of us keep one computer open with your medical records, and I keep my other computer that I'm using. We use Doximity here. So I have my laptop with Doximity on my right side, and I have all your medical records in front of me. So I'm using two mouses, if that is the correct word, but we have all of your records in front of us.
Well, that's great. And what are the typical hours of operation for telehealth visits?
So actually, as we are learning the system, we have been making virtual health visit very flexible at some point in time. It is up to your physician's discretion how many patients do they want to add on. But usually we have a set office visit. Like most of the physicians would like to stick with their plan. Either we'll give you a 20 minutes appointment or 15 minutes appointment, 30 or 40 minutes appointment. Or if we are doing a new patient, we can give you up to 60 minutes. So actually your time is allocated according to your needs and your requests.
That's great. So is it possible that some doctors will open up hours in the evening?
It depends. I know of some very highly dedicated physicians. Actually, I should not call myself dedicated, but I saw an urgent need for a patient that needed to be seen. So sometimes the beauty of this virtual visit is this: as long as we can communicate with each other and we mutually agree to set up a visit, and if their need is urgent, I bet all of my physician friends, we are very dedicated to take care of you.
So you mentioned in your presentation about Meritas, North Kansas City, having a portal to have these virtual visits. How does someone in the community find that portal?
So actually, first of all, you need to be my patient or you need to be a patient of Meritas Health to get an access. So once you come to our office, our staff, our nurses, they guide you. And when you are on virtual, my nurse Once she's talking to you, all of our nurses are actually trained to ask you whether would you like to set up a portal account. So they will give you a temporary password and then you can reset, and now you have an access to everything that we have.
So if I understand you right, so someone who wants to do telehealth or televisit just needs to establish a relationship with a Meritas doctor.
Absolutely.
Well, that's convenient. Okay, let's see if there's any more questions in the chat. No questions at this time. Just to reiterate, let's say I have a telehealth visit and my doctor recommends that I get some lab done or I need an x-ray. How does that happen? What does the doctor tell me?
So we will tell you, first of all, we will ask you, where do you want to get the labs drawn at? You can give us your preference, whatever is close by to you or whatever is covered by your insurance. Second thing, in regards to your testing, like x-rays, ultrasounds, or CAT scans, you can tell us your preference. Patients have very different preferences. They can tell us diagnostic imaging, Meritas Health, North Kansas City Hospital, or any other place. So just kindly let us know, and we will send the orders and then they will set up an appointment. For blood work, we usually do in our practice that once we order your blood test, we print a requisition for you, the lab requisition, and our nurses are super efficient. They're going to mail it to you, but electronically, when we send the orders, they are there for you. You can just go at your convenient time and get them drawn.
And you had mentioned that you can call in prescriptions after a telehealth visit. But let's say I'm on a water pill or a blood pressure pill and I feel like it's making me feel funny or bad. Can I get a telehealth visit to have you adjust my medicine?
Absolutely. Absolutely. I am all for my patients who are having shortness of breath, swelling of their legs, and I have patients who will flaunt their legs up in the air to show it to me. Doc, look, how does it look like? So we can do all those things. And actually, we can just, if you're feeling any different than your baseline, we would love to look at your kidney function, your electrolytes, and we can adjust your medications.
Well, that is great. I think you have answered a lot of questions. Thank you for joining us today. While virtual visits are convenient, certain healthcare needs may require an in-person visit, as Dr. Akhtar has explained. We're ready to care for you and have precautions in place to keep you safe and comfortable when you visit North Kansas City or one of our 30 Meritas Health practices. Find out more at nkch.org/ready. If you have a serious life-threatening health concern, we encourage you to go to the nearest emergency room. Again, thank you for joining us. Please save the date for our next virtual lunch and learn on February 3rd, when Dr. Michael Krim will present Health and Wellness 101. Have a good afternoon, and thank you.
Thank you.